Hello my dear viewers, in today's video I'm going to give you a perfect explanation what vitamins you really need to use if you're after 50 years and older, especially a woman, to preventing heart attack. Heart attack is leading causes of the death worldwide. That's why I really want to give you my expertise in vitamins against cardiovascular disease. A heart attack happens when the blood flow to the part of the heart muscle is blocked, usually by clot forming in the narrowed arteries. Without oxygen, heart cells start to die. That's why it's sudden, dangerous, and often life-changing. Heart attacks remain one of the leading causes of death for the woman over 50. But here's the truth, many of them are preventable. Our daily choices, what we eat, how we move, how we nourish our body, can reduce risk dramatically, and vitamins play a big role in this story. And this is unbelievably dangerous, my dear viewers, because we live in the world that those heart problems is a leading cause of the death worldwide. Why? Because we eat so much processed food, we treat everything with the chemical medication that have a lot of side effects. If you are on those paths for the couple of years, maybe 20 years, you are much higher risk of developing heart attack. Let's take a quick look at statistics so we see why prevention is vital. Globally, cardiovascular disease account for about 32% of all deaths each year. Around 85% of those deaths are caused by heart attack and stroke. In the year 2000, about 40 million died worldwide from cardiovascular causes. By 2019, that number rose to nearly 80 million. In 2023, it was close to 20 million lives lost every single year, many of them due to heart attacks. This rise shows us of one thing: while medicine is advanced, lifetime nutrition is the key to preventing cardiovascular disease and any kind of problem. I'm working with a patient for almost 26 years right now, and when you learn how through nutrition and natural remedies you really can prevent any other cardiovascular disease. It's not the way, my dear viewers, to take chemical medication each day. You eat whatever you want to eat and you think about it and you really don't take good close attention to those kind of problems. Of course, after 10, 15, maybe a couple of years, you are much higher risk of those problems. That's why I'm going to recommend you best vitamins for preventing heart attack. The most important ones is vitamin B12, vitamin B6, folate or folic acid, and vitamin D. How they work? Vitamin B12, B6, and the folate. These three works together like a team. Their main job is control homocysteine levels in the blood. High homocysteine damages arteries, make blood stickier, and increase the clot risk. With enough of those vitamins, homocysteine is broken down safely. They also help regulate C-reactive protein, or CRP, a marker of inflammation linked to the heart disease. And that's why you really need those vitamins each day, especially if you are 50 years and older. Because, my dear woman, you really need to know, after 15 years and older, everything is getting worse. Those people who take close attention to the good quality diet and take good quality vitamins, those loss progressions, deteriorations of our body is going to be lower. Everyone else is going to be on a higher path and in those unbelievably higher risk of those cardiovascular disease. Now let's talk about vitamin D, often called the sunshine vitamin. Vitamin D helps control blood pressure, supports healthy arteries, and improves the way your heart muscle works. Low levels of those vitamins are linked to the higher risk of heart attacks and strokes. Here are the common recommendations for women over 50. Vitamin B12 about 2.4 micrograms daily, because absorption decreases with age. Supplements or fortified food are often needed. Vitamin B6 is going to be 1.5 milligrams daily, support metabolism and nervous system as well. Folic acid about 400 micrograms daily, crucial for homocysteine controls. And let's talk a little about vitamin D. This is one of those important information for everyone. Usually, the recommended daily dosages of supplements are really low, maybe 600 to 800 international units daily. This is way too low. Right now, we know probably if you want to prevent heart attack or any other disease, you really need each day 3,000, 5,000, even 10,000 international units of vitamin D daily. The number one sources is, of course, it's going to be sun and directly sunlight on your skin. I always recommend you, if you have any kind of chance, each day expose yourself to the sun. 15, 20, 30 minutes, and you will see you will have a good quality vitamin D each day. Unfortunately, that's not the case, because we live in the world that over 90% of people, especially you women after 50 years and older, you have vitamin D deficiency. You can bet on it. That's why you are on a higher risk of blood clots and a heart attack. Did you understand me? Vitamin B6, vitamin B12, folic acid, and vitamin D is going to protect your heart. Let's make it practical. What food sources are rich in those heart-protecting vitamins? Vitamin B12 you can find in fish like salmon and tuna, shellfish, poultry, beef, eggs, dairy, fortified cereals. Vitamin B6 you can find in the chicken, turkey, bananas, potatoes, whole grains, beans, and nuts. Folic acid you will find in spinach, kale, broccoli, asparagus, beans, lentils, avocado, oranges, fortified grains. And vitamin D you can find in salmon, sardines, fortified milk, all plant milks, egg yolks, plus sunlight exposure. A balanced diet rich in those foods not only meets your vitamin needs, but also nourish your heart with the fiber, healthy fats, and the minerals. Dear friends, here's my message. Your heart has been beating faithfully for you every second of your life. After 50, it needs your care more than ever. By giving the right nutrients, vitamin B12, vitamin B6, folic acid, and vitamin D, you protect it against clot inflammation and damage. You give yourself more energy, clearer thinking, and a stronger, longer life, and that you really need each day. For everyone who suffers from those cardiovascular disease, you really need to know I work with patients for those kind of conditions over 25 years, and my specialty is going to be nutrition and natural remedies. So for everyone who wants to help take control of your life and cardiovascular disease, call +385 9891 79200. This is Malio Lab Center in Zagreb, Croatia. You can come directly to my office, or you can use me like the phone consultation. In each option that you want to take, it's no problem. I really make special nutrition and natural remedy programs specially for you. Even I'll send you the best natural remedy directly on your address. This is especially important for people all around the world, because I'm making those natural remedies program, nutrition, healthy lifestyle. For the decades, I believe I can help you a lot. Thank you for following my viewers. God bless you. God bless your family. See you in the next video. Bye bye.